show everybody. Is it Sabrina, I think, has got the certificate? Are you there, Sabrina? No?
Yes, give me a second. I'll get the certificate
up. Sorry. A second, right. And while it's and Yasina, are you there, Yasina? Yasina is the interim, Yasina Christopher is the interim vice chair. First time we've had a vice chair, actually. So what I want to do is to first of all ask the board members who are present to introduce themselves and say who you are, please. Hello? Who would like to start?
I'm go on, Cassie.
Oh,
right.
Everyone. My name is Cassandra Lovelock. I go by Cassie. I am a researcher and a PhD student at the London School of Economics, specialising in unpaid care.
Okay. Thank you very much. Who else? Does other people introduce other board members, please introduce themselves?
Hello, I'm Sarah Ubanjo, and I'm currently working as a clinical audit project manager for a medical society, and I've been on the board for just over 3 years now.
Okay, thank you very much. More, come on, we got some more people there.
Okay.
Lloyd, did you introduce yourself?
Lloyd French, local resident, currently retired, and I've been on the board for just over 3 years.
Okay, good, thank you very much. No other board members there? No? Okay, well, can I staff to introduce themselves?
Yeah, I'm John Williams. I'm the director of Healthwatch Hackney.
Other staff members, please. Catherine? No? Okay. Sabrina? Are you there?
Hi,
okay.
Hi, I'm still here. I think Catherine's on mute. Hi, I'm Sabrina Jantor. I am the Neighbourhoods Community Development Manager.
Okay. And are you our most recent member of staff? Any other members of staff around?
Yes. Apologies, I am here, and I'm Catherine Perez-Phillips, and I'm Deputy Director at Healthwatch Hackney.
Okay, thank you very much. And Leah? Jamal?
Hi, yeah, I'm here. Jamal Wallace here, Comms and Engagement Lead for the City and Hackney Integrated Care Partnership.
Thank you. And Leah? Not there? Okay.
I'm Leah, Finance and Office Coordinator.
Okay, thank you so much. Okay, first I'm just going to ask you if any board members have any conflicts of interest, please. No? No? Good, thank you very much. Just going to tell everybody how we're going to manage this meeting. Questions will be very welcome, but what we're going to do is to ask you to submit your questions in the Q&A box. And then a member of staff will look at all the questions and will feed them through to me, and then I will pass them on to our speakers, who will come to a bit later in the meeting. So I'll refer your questions to the most appropriate person to get an answer. Thank you. So let's just go on to the minutes of the last meeting. I don't know if these are visible, but I'm going to first of all ask if anybody has got any corrections to those minutes.
Yep, they're just hopefully just being pulled up now, Malcolm.
Okay, thank you.
Sabrina, are you able to pull the minutes up?
It should be displayed now. Are you not able to?
I'm not.
No,
I'm just seeing a folder at the moment with the AGM minutes. I'm not seeing the minutes. The document hasn't opened.
Let me do it again.
Okay.
Right, here we are.
Okay,
So I'm just going to go through the pages and ask people. There's, I think, 6 pages. I can't move it. So anyway, I'm going to say page 1. I'm going to ask if there's any corrections or matters arising on each page.
Could you
Page
scroll?
1.
Yeah. Could you scroll it, please, Sabrina? Yeah. Thanks.
Okay. Fine.
Okay.
Let's go to page 2. Okay. Go to page 3. Thank you. Keep going. Okay, there are no matters arising from anybody? No corrections of matters arising? No? Okay. In that case, then we'll accept those minutes as a correct record of our last AGM. And then we go on to the chair's report. But before we do that, I'm going to ask everybody if they could just observe a short silence for those staff members in the local NHS and also local people who have died during the pandemic. So if we could just reflect for a short time, I'd be very grateful. Okay, thank you very much, everybody. I'm now going to go on to the chair's report, which is I'm going to just read out to you. It'll just be a few minutes. This is some of my reflections based on recent events as a result of the pandemic and also the development of Healthwatch. So the pandemic has been disastrous and will continue to be so for some time to come, both in terms of health and economic impact on families across the borough. Deprivation, which always impacts heavily on so many people in Hackney, has been magnified to appalling effect during the pandemic. It has also demonstrated the collaboration and commitment of our local health and social care agencies and workers in meeting the needs of our diverse communities, and how community solidarity has also solidarity recently played a crucial role in supporting the ISS frontline workers at the Homerton Hospital to get sick pay and the London living wage. Healthwatch has a key role in influence on the quality, access and safety of Hackney's health and social care services. And we do this by bringing local people's voices to the heart of all our engagements with local leaders of these services. Listening to local voices and ensuring that they impact heavily on local services is fundamental to our reason for being. We also provide a special signposting service to local people that ensures that they can access the information they need about local services, a major issue during the terrible pandemic. Hearing these voices at a time of unprecedented lockdown has been a unique and sometimes disturbing experience. But we now face plans to coalesce the CCGs in northeast London to a monolith, yet experience shows that these conglomerations often become insensitive to local needs and local people. We have a very well-functioning local CCG, and I can see no logic in building a new distant bureaucracy. What benefits for patients can there possibly be as a new organisation spends years recreating itself instead of focusing on local needs, draining off resources from our outstanding local services to more highly centralised ones? Healthcare should be guided by the needs of patients, not hierarchies. The concentration of inpatient dementia services outside the borough is an example of a bureaucratic approach to patient care that targets the essential links, that forgets the essential links that people with dementia need with their family and friends. It is essential to understand that the needs of every community we represent varies and that they face different challenges, and we must ensure that our approach to engaging with them also varies. Healthwatch must reach out to everyone, especially those whose voices are rarely heard. Our roots must run deep. This point is critical as a borough moves towards establishing neighbourhoods, which seem to have been created without significant community input. But Healthwatch will be focusing on the development of community centre neighbourhoods in which we will ensure that local people have a much greater say and influence on the development of our primary and community services. Healthwatch has a unique freedom to focus on what matters most to local people, to explore issues, to find out what people think and need, and to use our resources to achieve change, whether by discussion, negotiation, or campaigning. The key thing is to make sure that we are truly understanding and representing local need. Our statutory role means that we have additional levers to make sure that the voices of all parts of our community are heard loudly. This includes the enter and view of primary, acute and social care, a unique system for lay people to reach out to those receiving care and transforming their experiences into proposals and recommendations for enhanced care to our colleagues in the Homerton, Elft, CCG, London Borough of Hackney and other providers. I hope that we will extend this approach to dental and optical services in the near future. We also raise major issues with the CQC and Healthwatch England when the local system is not meeting local need. For example, the failure of dentistry during the pandemic is a perfect example of where local needs have been elevated to our national colleagues. And there will be a meeting in public on this issue on September the 28th with Jeremy Warden, who is the Commissioner responsible for dental care across London. The future of St Leonard's Hospital is another major issue for us. It provides great services for the community, but the building has been neglected by NHS property. There is plenty of space to provide an outstanding new building for outstanding services. We very much want St Leonard's to be redesigned for and with patients. The community saved it from closure in the 1980s and occupied it, but now we need the Homerton Hospital to take control of St Leonard's and work with the London Borough of Hackney and the CCG, Healthwatch and all local communities to create an outstanding community hospital accessible to all. This specific request was put by us to the Homerton board on September the 17th. Our dedication to finding out the views of those who go unheard or unconsidered is one of the most important contributions that Healthwatch can make to the well-being of local people. When people feel that services have let them down, it's important that they can share their experiences so that the system can learn to do better. The public is also the best source of insight to help spot and spread good practice. It's crucial that everybody is heard, otherwise vital opportunities for services to learn and change will be missed. Some of the other areas of work we'll be involved include influence in the contract for PTS services at the Homerton Hospital using our own quality standards and the complaints charter adopted by all major health and social care agencies, but sadly not by GPs. We will attempt to extend the charter to GPs, dentists and opticians. We work well with colleagues in our local hospitals, Homerton and Elft, who have been recently rated outstanding by the CQC, and with the CCG, the GP Confederation and the London Borough of Hackney. But we make our biggest difference when professionals and policymakers understand our independence, value our role as a critical friend, and are open to acting on what people are telling us is happening on the ground. The most effective services are shaped by those people who use them. There is much to do. We need to be looking much more closely at local mental health services, get into more regular dialogue with the leaders of local services to negotiate change where it is needed, support the development of more powerful patient participation groups in primary care, and expand this concept to dentistry, which seems to be failing us right now. Healthwatch also needs to move onto the high street so that it's more visible. We need an office where people can see us, accessible to all. Thank you to our excellent speakers and participants today. Thank you to John and Catherine and the staff team for organising this event and doing so much fantastic work. I'm very proud of our staff team, board members and volunteers for making this such an outstanding organisation. Thank you very much. Right. the next item on the agenda concerns the board members. So to report that board members who retired since the last AGM, a sad loss for us, were Paula Shaw, Heather Finlay, and as I already mentioned, Rupert Tyson. We're absolutely delighted that Sarah Oyebanjo and Lloyd French have been reappointed. Congratulations on a great move. And a warm welcome to new board members, Cassie Lovelock, Salim Siddiqui, and Philip Jones. Cassie is, as she was already said, is an expert in mental health issues. Salim Siddiqui is somebody who has had many senior positions in the local borough, including that of mayor, has been was a councillor for many years. And Philip Jones, somebody with a long history in social work and a mental health background. So we're very lucky and privileged to have people with such talent in the organisation. So I'm now going to, how are we doing for time? We were going to have a break right now, but I wonder whether, John, would it be better if we continue with your presentation now? If John is there? John, are you there? No. Okay. Catherine, are you there?
Sorry, Malcolm, I'm back. Sorry.
All right, John. John, I just thought in terms of the time, would you like to do your presentation now?
Antonia's here. I mean, Antonia's here. We've got
again.
We have Antonia here. She should be doing the secretary report.
Right, sorry, yes, I do apologise. Sorry, Antonia, I'm very sorry. Antonia, carry on. Antonia? Antonia, where are you?
She's there.
John, I think that might be a different Antonia.
That might be a different Antonia. Right, okay, so where's our Antonia then? No, there she is. No, she's in chat. Antonia Gesedo. Could you just put her into the panelists, please?
What's the name in the attendee list?
Antonia J.A. Antonia Gesedo. Just after Anne Saunders.
Oh, okay, I've just seen her.
Okay.
Antonia.
Hello, Antonia. Do you want to unmute yourself?
Hello, good evening.
Hello, Antonia.
Hello, Antonia. I just got the order of events wrong. I do apologise.
No, I think to be honest with you, I need to go through the tunnel now. So can you take my agenda item in the next 10 minutes?
Malcolm, shall I do the presentation then on the annual report?
Yeah, that would be better, yeah.
Okay.
Then we might have yours a bit later, Antonia.
Okay.
Yeah, that's fine. That's fine.
Okay, fine. You carry on, John.
Okay, so Sabrina, can you put the my presentation up, please? Thank you.
Are you not going to share it yourself, John, or do you want me to do it?
Could you share it? Yeah, please.
Okay. Give me a second then. Can you see that?
Yes. Yeah. Could you put it on full slideshow, please?
Absolutely.
And then go to the fourth slide. Thank you. Thank you very much. Well, thank you all for attending our meeting this year. Last year was a year of progress and consolidation for us. 2018 was a challenging year for us. But over the last year, we've managed to get back on track in terms of delivering our contracts and a firm basis as an organisation. And I would really like to thank the board and the staff and the other volunteers for all the work they've done over the last year to make sure that happened. As Malcolm has said, the big impact this year has been, even though it happened at the end of our year, was COVID on the residents and also our service. It's limited our ability to do the face-to-face work that we so value to do. But I think Malcolm was very kind of clear. It's had a massive impact on particularly those residents who are most disadvantaged in our community. And we mustn't forget what's happened to them. We must make sure there's some real change in the way we do things and the way we tackle inequalities. The other thing to note is that there's satisfaction in health and care services continues to slip. I'll mention a bit more about that later. The funding for the council is tight as ever, and CCG funding is whilst better, is not exactly kind of flowing with the flow overflowing, and our own funding is also tighter. And we are kind of concerned about what the impact of COVID and potentially also the Brexit will have on the general economy and what will impact on funding as well. In terms of long-term services, some are becoming regional, and this is a concern to us because it impacts on the way people can go and see people in hospital. For example, our dementia services are moving to East Ham, and this is part of the long-term plan, and so we really want people to kind of continue to kind of ask questions about why services are regionalised and what's best. As Malcolm has said, St Leonard's is we believe an option for people of Hackney to have better services more locally. Sabrina, could you put the next slide on, please? Thanks. So just a couple of slides on what we must do as a Health Watch. Essentially, we're here to kind of make sure that we kind of promote and support people and that get you involved in kind of looking at the local services and scrutinising them and asking questions about them and telling us what you think about them. This is all about making sure we can improve those services. So it's all about monitoring and enabling our volunteers and as members of the public to make sure that we pick up what your recommendations are and we do something with them. Could you put on the next slide, please, Sabrina? So we publish reports and make recommendations on improving services. And I think one of the main things that we want to make sure happens, and it can be a challenge, is that people take up our recommendations as well. And I think we did, as an organisation, we need to be pushing more on that as well. It's all very well that we make recommendations, but people need to do things with them. An important part of our work is actually signposting and giving advice and information to people. We continue to do this, and in spite of the challenge that we have at the moment, it's a very important aspect to us. We know that people that want to use the local services, we need to make sure that they're fully understood by people. Finally, we also...
John?
Yep.
Sorry to interrupt. Do you want to take questions at the end? Because there's a few people who have raised their hands.
I'm happy to take some questions now.
Okay. Catherine, are you able to check who's raised their hands? Because it's a bit difficult for me to do that whilst I'm sharing the presentation. I've just seen a notification popped up of one raised hand. So if you want to allow that person to speak.
Yes, I'll have a look. Thank you, Sabrina.
Okay, let me kind of press on with the presentation while we sort that out, because I'm kind of conscious of time. Okay, so let's go on to the next slide. I think it just might be easier if I take questions at the end, because I'm just kind of conscious it might become quite...
Yeah, that would be much better.
Yeah, we do questions at the end. Okay, so next slide, please, Sabrina. Okay, so what did you tell us in the last year? As I said, there's a trend to being less satisfied with services, a 2% drop last year. I mean, that's based on a 60% positive, but that's also on top of a 5% drop last year. So there's a trend downwards at the moment. So we're seeing services increasingly under pressure and less able to kind of satisfy the population. Communication needs to be better. This is a constant theme that we find from the public, that the services do not communicate well with them. So it's a constant issue for us. The residents are also very clear that they want to make sure there's a full range of services at the Homerton, and this is something that came out of our engagement on the NHS long-term plan. And so we are concerned about the loss of kind of services like the reduction of services like pathology and also the mental health services that are moving out of the borough. So we do want a full conversation and consultation on any of those changes. Mental health continues to be an area that people want to see better improvements, and with the impact of COVID, we know it's going to get more challenging. So this is a key area, I think, for us to make sure that things really happen and support people for what's happening at the moment. Can I go on to the next slide, please? Okay. On on the positive side, yeah, people are clear. Most people are really happy with the treatment they're getting there. That it's good quality and it's compassionate and caring, and we thank the services for achieving that. Most people also feel involved and supported by their clinicians and their practitioners. So that's good to hear that people feel like that those services are supporting them and involving them in their work. We are seeing increasing complaints about service access. This is kind of, we're pleased that people are using complaints to do this. We certainly want the services to respond to these access concerns. As I mentioned, communications could be better. That's why it's mentioned twice. It really could be better. We're continually concerned about the way that people are not communicated well by services, and people find things confusing. Waiting times are also a continuing issue, and we suspect, given all the challenges with COVID and the impact of waiting times, this will be a growing issue over the year and probably into next year. Could I have the next slide, please? Okay. Volunteers, they're extremely important to us at Healthwatch Hackney. They're the key way we deliver a lot of our work. Our board of volunteers, many of the people who do our work that support us are volunteers. And you can see how many hours they put in to kind of help us improve local services. We're very, very grateful to them. Without them, we would not be operating an effective enter and view service. We wouldn't be collecting feedback as well as we do. And we wouldn't be have a really great functioning board that really kind of, is the voice of our local population and helps us organise. I'm extremely grateful to those volunteers for all the work they do for us. Thank you. Next slide, please. Okay, signposting is a kind of key issue for us, as I mentioned earlier. We've helped about 360 people last year in finding information. What we're finding in the busiest areas for us is really support for disabled people, and we are picking up certainly around COVID that for disabled people, the world is becoming much, much more challenging, and these are the groups of people that we need to be making sure properly supported. COVID-19, although catching the end of the year for us, became a very busy area for us, not surprisingly. Mental health services continues to be a biggish pressure area for us, and we've done a number of enter and view reports in the last year over those services. NHS complaints, we continue to point people to make NHS complaints, and so we're pleased that people are doing that. Malcolm's mentioned the complaints charter. That is a very effective vehicle, we believe, for promoting complaints in the borough, and we urge all services to be involved and sign up to the charter. Although we're disappointed at the moment we're not doing much face-to-face work, but we hope we can return to that sometime in the future, but we're not sure when, of course. Next slide, please. Okay, one of the key things for us is really making sure that those seldom heard voices of residents are heard properly and loudly and clearly. And certainly we were very pleased to help the Hackney Council when it had the challenge of the Housing with Care service that was deemed inadequate by the Care Quality Commission last couple of years. And we've supported that process and made sure those voices were heard, and that service has improved as a result. And we're very pleased with the efforts that the council has put into that as well to make sure it doesn't improve as a service. Migrants was another area that we worked on last year. Migrants' health is a kind of a key issue for us, partly because of the way they are kind of pushed out of services at the moment by being forced to pay for those services. We are very concerned about this approach, the way that, because the migrants then avoid taking care of themselves because they're fearful of the charges. This is not a good way to run the system. People need to be supported first before they're made to pay. Older people continue to be a focus for us, particularly at the moment because of the isolation and the challenges they faced during the pandemic. And so we had a very brilliant Staying Well event last year, and we continue to want to think about how we would engage with and involve local older people. Sickle cell is a particular area that we want to keep focusing on as well. And this is partly around the regionalisation that we're concerned about. We have a lot of people who suffer from sickle cell in the borough, and we want to make sure that they're properly supported. I'm really pleased about the level of service locally at the Homerton, but we are concerned the regionalisation will make it more challenging to make sure these people get the services they deserve. So we'll be keeping an eye on that in the future. Next slide, please. Finally, we want to make sure that public involvement is kind of a key part of whatever health and care services develop in the future. So integrated commissioning is the big game in town at the moment, and we are involved in that. It is changing a lot, and we've got a meeting on the 30th of September with David Mayer from the Clinical Commissioning Group. We're talking more about the changes that are happening in the merger of the CCG. But we do think that the public must be involved as equal partners. There's a thing called neighbourhoods that we want people to hear more about, and this is essentially where more services closer to you at home and in the community. This is a kind of a major change programme in the sense it's moving services out of the hospital into the community, but we want to make sure the public are fully involved in that and also the public understand what these neighbourhoods are. We've been operating an involvement alliance which helps organisations work together more effectively, making sure those seldom heard voices are really kind of heard properly, but also you can actually make sure that we're picking up those issues that we're not picking up at the moment. NHS Community Voice continues to be an excellent vehicle for us to actually hear people's voices and has been highly effective in kind of gathering voices throughout the year and will continue to do so in spite of the impact of COVID. We continue to see co-production, which is essentially working together as a key way of going forward and making sure the public are fully involved from the start in any changes to services or development of new services. It's not there yet. We need to do a lot more work, I think, on that locally, but we'll continue to push that as a major issue for us. Could you put the next slide on, please? Okay, so we're coming to the last couple of slides. So how can you help? Encourage your family and friends to sign up to our newsletter. It's really important that we kind of get news out, and we really want to make sure it's an effective newsletter. So feedback to us on the newsletter is really helpful. Please get involved in the events that we run. Currently they're very virtual, but we are thinking about how other ways we can engage with people. It's very important we get your views and just keep talking to us about your experiences because it's key for us understanding what's happening. And the final slide, I think, is any questions. So I'll happily take some questions.
I think we'll take a couple of questions now, John, and then the rest will go to the panel because you're on the panel.
Okay. Yeah.
Because we're quite tight for time at the moment.
Okay.
So questions, please. Questions for John?
I thought there were some, but we can always take them later.
Catherine, had you found the people who wanted to speak, or do you want me to do it?
Nothing in Q&A.
I thought that I had actually unmuted the people, which is one of them is Shirley Watkins and one.
Okay. Well, why don't we? Could I suggest? Could I suggest that we take Shirley's question, which I'll read out, because I think that's probably most relevant to you. Can you hear me okay?
Yep, I can hear you.
Okay, so Shirley's question is, among many changes being top-down imposed under cover of the COVID-19 necessity on the NHS, and without any attempt at consultation, there appears to be a major absence of service user involvement, which is more crucial than ever. Will Healthwatch Hackney initiate regional and even national Healthwatch collaboration to ensure an agreed, robust and sustainable structure for genuine service user involvement at all levels of decision making and service evaluation, including involvement? That's from Shirley McGrath.
I think that's an excellent question. I think I really am concerned about the way that what they call the NHS reset is essentially a top-down exercise where there's apparently 12 principles that have been imposed upon us. I am concerned about the kind of the general drift that people are losing faith in institutions. We did a survey just recently that demonstrated that people are kind of losing faith in the information they're getting from people. So there has to be a way that people are properly involved in their health service. It is their health service, and at present, I get the sense that some people don't feel it's their health service. The only way you can make sure it's your health service is that the public are genuinely involved. We are very committed to making sure this is happening, and we're working locally in terms of the neighbourhoods to make sure that the proper, genuine public involvement and those services really get to know their communities. But those communities can also feel like they have real influence on that. I think the call is from Shirley is absolutely right. We should be pushing as hard as we can to make sure there's genuine public involvement and call out when it's failing, because I think that's the important thing. As a health watchers, we must be very careful we don't collude with any of this that's going on. One of the things I'm particularly concerned about for these 12 principles is the attempt to kind of impose juries on us. That is not a good idea. It's taking away public involvement. It's not expanding it.
Yeah, thank you very much for that, John. Sophie Ibbotson asks whether the meeting's been recorded, and if it is, are questions being saved? So the answer is that all questions put to the meeting will be saved, and the answers, and we'll put the questions and answers onto our website so everybody can see what the questions and answers are. Now, I think probably we'll have a short break now, and then we'll go on to the panel of speakers in about 10 minutes, if that's okay. Well, not in about 10 minutes, in not more than 10 minutes. Okay, we'll see you in a few minutes. Thank you very much.
Thank you.
What do we do?
So I was going to...
Right. Right. Are we just about ready to get going? Can you hear me?
Yeah.
Yes. Ready?
Yes. Yep.
Ready? Steady? Go. Okay. Welcome back, everybody. Hope you had a nice break. Right. So I'm now going to welcome our panel of speakers. And first of all, Chris Lovett is going to do a presentation. Chris is the Deputy Director for Public Health for City and Hackney. Hello, Chris. See you there. Very, very warm welcome to our Mayor, Philip Glanville, Mayor of Hackney. Are you there, Philip? Yes. Thank you, there. Dr. Mark Ricketts, I know that you were there a minute ago. Hope you're still there. David Mahir, John Williams, our Director, and Chris Kennedy. So I'm going to ask Chris if he'd like to start his presentation. And then once Chris has done, once he's given his presentation, what should be about 10 minutes, we'll then go into questions for the whole panel. Okay, I see you're there, Philip.
Good evening, everybody. Can I just check if people can hear me okay?
Yes.
Great. Okay, well, thank you very much for inviting me. First of all, an apology from Sandra Husband, the Director of Public Health. She's on leave this week. It's also a great opportunity for me to meet people. There does seem to be a lot of background noise. But it's a great opportunity for me to meet people, and just to introduce myself, I started a fortnight ago as the new Deputy Director of Public Health. So what I propose to do is just set some background around COVID, and then very happy, along with all the panel members, to answer some questions. I prefer not to take questions through the presentation, but leave more time at the end. So hopefully this is working. So firstly, just to give you a sort of set the scene, I think everybody has been following the national news. Hackney, as well as all the areas in England, are experiencing an increase in the number of COVID cases. What we have also as a slight difficulty is that we've got really significant problems of accessing COVID tests. So what you can see on this first slide is that we have got an increase in the number of cases. In the last couple of weeks, it's actually fallen off. Now, that's almost certainly not due to a fall off in COVID. That's due to the fact there is really significant difficulties accessing the tests. So this now only presents a really partial picture, because up to about 3 or 4 weeks ago, there was reasonably good access to testing in Hackney, as in most other places. But because of the national shortage of testing and the difficulties with increased demand for testing, that the actual number of cases has gone down. So that's not a really true reflection of what we think is happening in the local picture in Hackney. It's much more about the number of availability of tests. What we can also see, which is really important to give us that indication that we think there is more COVID being transmitted locally in Hackney as in elsewhere, is the positivity. So this is the percentage of the tests that are coming back as positive, and that is increasing really quite rapidly. There's been a 47% increase in the previous fortnight for Pillar 1 testing and a 12% increase for Pillar 2 testing. So the other area of really significant concern is towards the summer period, locally as well as nationally, we were finding that most of the COVID that was being transmitted was amongst the younger people. That has now changed, and we are getting an increasingly older people who are coming forward, getting tested and shown to be positive. And that's of concern because obviously we know that the more serious COVID infections happen in some of the older populations that we have. And so this is now a change. It's not solely confined to the younger age group in Hackney. And then looking at the distribution of cases, so we are able to map the positive cases. And again, just giving you that health warning about the fact that we know there's a lot of people who want to get tested, and unfortunately, because of the national shortage, they can't. But we are seeing that there is a real change in the way that the local cases are distributed, and some real concentrations towards the top of Hackney and less so towards the south. And then this is looking at the, apologies, I live on a noisy street in Whitechapel. So this is looking at the distribution of COVID cases by ward, and you can see there's a real concentration in towards the top of the borough and fewer cases below. But again, just being aware that these are relatively small numbers, and it is very dependent upon being able to access those testing. And this shows you the kind of the daily variation amongst some of those wards where we have got increased numbers of COVID cases. And then looking at some other sources of information. So clearly the difficulties with testing is causing some real problems in us being able to understand the epidemic. But if we are looking actually the phone calls that are being made to GP practices, so this is people who think they have COVID, may not be able to get a test, are worried, you can see that they have been increasing really quite significantly, both to the 111 calls and also in relation to things like staff absences. So we're very confident that the increase, there is a significant increase in local COVID transmission. So I think people will be aware that yesterday the Prime Minister made some really quite significant announcements that are looking to address the issues of increasing COVID transmission. So these are a real summary of them. The ones that I think are particularly important to highlight are obviously changes in the retail, leisure and tourism industry, the fact that the COVID secure guidelines will now become a legal obligation, which will no doubt help make sure that there's a real clarity of message that people are now required to ensure people are wearing face coverings if they're required to do so for things like retail and taxis and other settings. Obviously, there's also been a reduction in the maximum number of people that can come together. So that was announced previously, the rule of 6. And again, from next Monday, there'll only be 15 people who can attend wedding ceremonies and receptions, and then some changes in relation to the penalties that are available if people are not following the guidance. And then just a summary, and this, I'm sure the other panel members will talk to this in greater detail, but this is really what we've been doing as a partnership across the NHS, the councils, voluntary sector, and with communities and residents to actually address obviously the increasing rise in COVID. So we have had an outbreak control plan with some very detailed standing operating procedures, which cover many of the settings, care homes and schools and businesses. There's been a multi-agency incident management team that we've had and been looking at how we can address the outbreak in the north of the borough. We've done a week-long action to promote social distancing and mask wearing with the police and with others. We do some very detailed monitoring of the COVID statistics, and we're looking to increase the input from NHS and other partners so we can look at the impact on things like hospitals and primary care appointments. There's been a local contact tracing service that started now in Hackney, one of the first in the country, run by our colleagues in the contact centre. That started yesterday and has already been able to contact people to get their details so that we can support the NHS test and trace service. We have a weekly health protection board, which has got really good engagement with partners across the partnership. And there has been very strong engagement with the NHS and Public Health England and the Department of Health about the difficulties that the testing, accessing testing is causing us in controlling the epidemic. And then from tomorrow, you will have probably heard that we have got the NHS COVID-19 app. It was trialled successfully in Newham, and we have been working with businesses to promote the use of that and making sure that there are QR codes so that people can check in. So that's the end of my presentation. Thank you.
Malcolm, you're on mute at the moment.
Okay, you can hear me now. Yes?
Yes, we
can.
Can
you hear me? Okay, good. Thank you very much. Thank you so much, Chris. I just want to ask, just before we take questions, I would just want to ask Philip Glanville whether, I know that your time is a bit limited, whether you wanted to add anything to the presentation which has already been made. Any sort of particular comments you might have.
Thanks, Malcolm. I probably can't add a huge amount to what has been sort of said on a kind of non-political level, but in a soft political way. One of our biggest challenges is still testing, and the huge amount of work has gone in from the health partnership. That's the council, public health, GPs, local NHS of kind of creating and improving the testing capacity locally. So Bentley Road, which has been our testing site since the start of May, went 7 days a week a couple of weeks ago, 12 hours a day. We had a second site in Stamford Hill. We are very close to signing for a third site in Hackney Central. All of that was to create and give us the testing capacity to support what was happening with schools going back, the economy opening up, and building confidence in being able to access the test locally. As I'm sure many people watching this from Healthwatch and others will have heard us say in other places, that has all gone sharply into reverse, to the point where over the last 2 weeks, the testing capacity has been unbookable and unturn-upable in Hackney. And that really does mean that all of the work that our public health team have done to do the data analysis that you saw a few moments ago, to now work on contact tracing at a local level without the data of those positive tests, or the reassurance of negative tests, that job is a lot harder. And I was told this afternoon that the Bentley Road Testing Centre now only has 60 tests a day. If you contrast that with a testing centre that at points was testing up to 300 people a day, admittedly it's open more regular hours, but the biggest challenge I think we face at the moment, notwithstanding the announcements from the Prime Minister yesterday, is that lack of London testing capacity. And all of our messaging, which has been repeated by so many people in that wider health and social care partnership, was sort of explaining people how to get a test, and that has been effectively undermined by the movement of tests outside of London, allegedly. So that's all I would add really as a way of kind of context. We continue every avenue we have to try and push the message. We need that testing capacity back in Hackney. Okay.
Thank you very much for that. A question for Chris, which is, which companies perform these tests in Hackney? The PM says that NHS Test and Trace, but I understand that these companies are all private. Which labs are the tests being sent to for analysis, and who owns these labs? How far are the tests being sent to? And how many tests have been done in the past week in Hackney, which I think we just had the answer to? And how long do the results take, and where are the results sent to? GPs, DPH, or patients? And that's from Coral Jones.
So a really timely question, so thank you for the question. I'm not able to answer all of it. It is a partnership, as the government would say, with the private sector to deliver the testing. The local council does have a really significant role in identifying the sites and making sure that those sites are suitable, but it is a private, I believe it might be Serco, who actually run the testing services, so actually supporting the taking of the tests. It is branded as an NHS service. It's not the only part of the NHS which does have that public and private partnership. And in terms of where they tests are sent for analysis, I'm not aware of the exact location. There has been a lot of talk about there will be a new testing centre identified. I think it's in Leicester. And there have been some of these tests, certainly nationally, there's been a confirmation that they are sometimes sent abroad in order to deal with the peaks. And in terms of how many have been done in Hackney in the past week, not as many as we would certainly like. I think as Mayor Glanville has indicated, there has been 60 tests perhaps a day, and that is significantly lower than certainly we do require in some of those testing sites. And then in terms of the other element of testing, obviously there is the self-taken tests which are sent to your home. There has been, again, really difficulties in actually accessing that services, even if you're able to get online or to phone and try and get one of those self-taken tests. So I think it's fair to say it is a very less than satisfactory system at the moment, and that representation has been made very strongly to both Public Health England, Department of Health and the Health Secretary.
Okay, thank you very much. And there's a question here from Kay O'Brien from the Hackney Bay Association, and she says, how can we be informed when and if there are local school outbreaks? So who would be, is that for you, Chris? I think it is.
So we do get very detailed information both directly from the schools into Public Health and also into Public Health England. And there are obviously at the moment, if you've got any of the COVID symptoms, you're a suspected case, you would be sent home and you'll be given a very clear message to get tested. Obviously, when you've got a confirmed test, that is when usually we get much more of the information and where we may have concerns about an outbreak. But it is very dependent upon getting that testing system right. So at the moment, there are daily updates that we get. I'm not aware that we have any outbreaks in schools. There will always be people that at the moment have been sent home waiting a confirmatory test. And that information we don't collect because it would be too burdensome. But it's very much, if you've got a positive test, then yes, we do get to know, and we are able to track the response to that in schools.
Okay, thank you very much. Another question here from Shirley McGrath, who says, why are you calling it NHS Test and Trace, effectively supporting the government's dishonesty on this? It's not NHS Test and Trace, but a hugely funded private sector exercise, which everyone except the government agrees is largely a shambles, which is costing people's lives. She also asks, how many reports have there been of non-distancing and non-mask wearing by staff in restaurants, and what action has been taken against them? So I think maybe both Chris and Philip might like to respond to those questions.
Shall I go first, Chris, and then?
Yes.
So I think we would all agree that NHS Test and Trace has far too much involvement from the private sector. And I go back to what I said last time. We had a very good relationship with the Army when they were running the test sites in Hackney. They took part in the strategic planning. They were very good at sharing information and data. And those sites were taken over by Deloitte and Serco in recent weeks and months. So to answer the question, those sites were operated by Deloitte and Serco on behalf of the government, which is part of the broader NHS Test and Trace. We've consistently, month in, month out, advocated for a greater role for the local NHS and the local public sector in testing and the test and trace, both ends of that, the test and the trace. What Chris outlined is this week, I think yesterday, formally, our local contact tracing run by Hackney Council from our contact centre went live. So all contacts that are made by NHS Test and Trace are now followed up locally by our team, and they are council staff, and they follow up both the ones that have already been tested, contacted by Test and Trace, but also those that have been failed to be contacted by the National Test and Trace service. And underneath that, some key things as well, that we do a humanitarian check. So we're able to connect people into the council's humanitarian response, and also people that are being traced get a call from a local Hackney number from our contact centre. So rather than getting a national contact centre call you from a withheld number, a lot of the evidence from other areas of outbreak in the country is having that local contact, people that know where you live, know what type of life you're living and what support you might need, is incredibly important to what happens next. So that went live this week, and we still advocate for a greater degree of public sector involvement. And there's, obviously, GPs could have been involved earlier on, public health could have been involved earlier on. The government chose to do a national centralised system reliant on the private sector. And I think, that has failed. And one of the reasons it's failed is for some of the debate that we're obviously having, but it is called NHS Test and Trace, and it's really important in terms of messaging that we do have to repeat what it is called, the website it goes to. That doesn't necessarily mean we endorse the methodology behind it. I don't know if Chris might want to add to that, and also what we're doing to support businesses to be COVID safe.
Thank you very much. Chris, do you wish to add?
I mean, I can't disagree with anything that's been said. I think there is also just the NHS COVID app is being launched tomorrow. It does provide another response that we can use to help identify people that have come into contact with COVID and to self-isolate. Again, it is a public-private partnership, to use the government's terminology, but it is a really important part of that response that we need to have to COVID, is to be able to help people who have been identified as contacts to self-isolate. The government did make an announcement that there would be the £500 available. They've given that to the council to administer. So for people who meet certain criteria around benefits and income, there will be support for people to self-isolate if they're either being confirmed as COVID positive or a contact and need to self-isolate for 14 days. So yes, I mean, it is certainly the national direction and the national policy is to continue to offer these as public-private partnerships, but I think there's absolutely a desire to make this work, and certainly the work that's gone on locally to put in place the support for NHS Test and Trace, I think is very much showing the strength of the council working in partnership with the NHS to deliver a much better programme.
Okay, thank you very much. Do we have other questions concerning the pandemic? I know there are a couple of hands that went up, but I couldn't see them. Are there other questions, please? No? Then we have some other questions about other areas of work. Actually, there's one question here from Paula Shaw, which I think, Philip, you might like to answer. The question is, how can we influence the regional and national leaders to deliver as well as our local leaders in Hackney do? Maybe, Mark, you might like to comment on that question as well. I don't know if Mark can hear me. Could you hear the question?
Yeah, no, I did, about how we influence national leaders as well.
Where are you going?
So did you hear the question, Philip?
Yeah, sorry, I was posting something.
No, I thought you both might have, Mark and Philip both like to comment on this question.
So this isn't easy, and there's obviously the type of campaigning people would do, the type of letters that people would do, they're calling people to scrutiny. You know, very early on, I think Councillor Hayhurst organised a scrutiny meeting where he had members of Independent Sage attending and debating what we could do better. So I think that the council itself is trying to make itself open to those ideas and permeable. We sit in a good practice network as a local authority with Barnet, Newham and Camden, and a lot of information sharing and a lot of the joint work that I've been talking about, that Chris and the public health team have been fitting in, have effectively been peer-to-peer work within London's local government. That then projects up into what's called the National Local Outbreak Board, which is where all the good practice network boroughs meet weekly to compare notes and advocating to government around all of these issues. And to be honest, sometimes it can feel like that you're beating your head against a brick wall, but actually some of the incremental improvements have come from that week in, week out continuous engagement. And whether that's on the additional support for people that are self-isolating, whether that's constantly making that case that we can do more if you empower us to do it, getting the 3.6 million for public health, talking about GPs being an untapped resource, but then not having GPs dropped in it by a testing centre saying, go to your GP if you want a test, which I think Mark reported to me last week. So I think what can feel quite powerless is when you're outside of the system. And I suppose, to go to Paula's point, it's hard enough when you're kind of attached to the system to win these changes than it might be for sort of health activists and patient representatives outside of it. But I do think there's a role for Healthwatch, and I think this is a really important discussion. And you know, the lived experience of Hackney residents through this crisis, of the health system, of testing, of the council's call centre, whatever it might be, are really valuable things that you can add value to. I know you've been sampling some of that already and feeding it in.
Okay, thank you. And Mark, would you like to contribute to this question?
I mean, I think in general terms, I'd echo what Philip's just said, really, because although there are slightly different mechanisms of feeding back information, whether it's to the North East London area and then the North East London come together to report things and issues regularly to London region, and that gets fed up to the national board. We do write letters. We do make our views known to those various bodies. As Philip says, sometimes you do feel like it is a kind of a beating your head against the brick wall type, because you know you don't necessarily see immediate change, but after a while you think, well, actually maybe we have contributed to the policy shifting in ways that we want to see. So I mean, we carry on with that. I mean, locally we kind of talk to each other all the time, and so in some sense we shape each other's sort of policies and ways of working like that, because that's become very much more our business as usual in terms of how the CCG talks to local authorities and how, you know, the hospitals, etc., etc. There's way more integrated work going on, and actually, as a system across City and Hackney, we were doing a lot of work developing those ways of working before COVID, and having sort of set some foundations. It really helped us when COVID struck, actually, in terms of those relationships locally.
Good. Thank you very much. I'm just going to change the subject now, because we have a question from Coral Jones that says, people in Hackney applaud the Healthwatch approach to St Leonard's Hospital. We need the site developed for needs of the people of Hackney. How will people be consulted about St Leonard's, and will they have a real say or be fobbed off? I think maybe Mark, you might like, both Mark and David might like to comment on this question.
I know David is closer to the detail. I mean, he's just come back. But certainly one of the frustrations is its ownership by NHS Property Co. So we aren't in a position locally to just determine our own kind of future with this. But a lot of work has been going on in terms of enabling and understanding where we are with St Leonard's. That has been slowed because of the COVID response and the need to push resources into managing the COVID response and the subsequent response of trying to get care and health and care back up and running in the context of COVID. But there is work still continuing in that around St Leonard's, and David, as I say, is more closely cited on it, so I'll hand to him to talk about this.
Thanks, Mark. Thanks, Mark. I mean, I've written to you recently, I think, on Healthwatch in response to your letter some time ago. I think, as Mark says, we're committed to a public sector solution to the St Leonard's opportunity. I think it's fair to say we're not entirely clear on NHS Property Services' current financial position. That would obviously have an impact on how they view the site, but for now we're continuing to explore options for what redevelopment might look like on it, to include a significant health facility. Those discussions have been broadly paused during COVID, and it's certainly a piece of work that I suspect will pick up in due course over the coming months. Those services are still running out of St Leonard's during COVID, so the foot clinic continues to operate. It is by appointment, so the walk-in services have been suspended, as people might understand. But regarding St Leonard's, it is a massive opportunity, but with deeply complex issues underpinning it, not least finances in relation to how one would go about investing capital to renovate that site, and that kind of resources in diminishing supply as we go through COVID and come out the other side of some of our work to make hospitals safe. So I'm sorry, I can't have a more consistent answer than that, really, but the commitment to involve the public remains front and centre.
Thank you. One second, I've got to close a window because the rain is flooding in. Right. The rain has suddenly hit us rather hard. Just another sort of rather diplomatic question, if you like. Is there more that we could do to persuade Homerton Hospital to take a more proactive role in perhaps discussing with NHS property how the site could be transferred to us rather than them? Because it seems as long as it's in the hands of NHS property, we're not going to make any progress. Or am I being naive?
No, I don't think you're being naive. I mean, I think these are complex issues, not least because we obviously want to get a social value orientated solution for St Leonard's, and NHS Property Services have their own contingent pressures in terms of releasing value from those assets. I do believe Homerton Board were looking at taking a step forward to take on the freehold for the site. I'm not sure where that got to. No doubt it has been slightly stymied by matters relating to COVID, but that's certainly something I think we can pick back up with them. And I think the CCG, and I know Mayor Glanville and others would support an initiative like that keeps that resource local for us to determine how it is used and developed.
Okay, thank you very much. I've got another question.
Malcolm, maybe it's worth reiterating that in the meantime, those services are still running from,
absolutely.
St Leonard's is a site that still supports, physio.
Yeah.
So lots of stuff.
Precisely, that's the point. We've got really good services on the site, but we've got an absolute appalling building, and it's about time. I think we all all operated together to bring about a transformation. I've got another question here for Chris, which says, if test is present at 60 tests a day, what does that say about the potential scandal of that closer to the disaster that rivals that of the South African HIV preventative mortality rates that occurred because the government refused to distribute the vital treatment needed to protect against high-risk infections? Will this be repeated in Hackney with COVID-19? Quite a complex question. How about that, Chris?
So I think the issue that's being referred to in South Africa was neglect by a government over many, many years. That there is certainly massive room for improvement in the national government's operation of the testing program. So I don't think anyone's going to try and defend what we have. I think the difficulty is the fact that if you haven't got a positive COVID test, then you really should, if you've got symptoms of COVID, you really should be self-isolating for 14 days, and also all of your household members as well. And the only way that you really should release yourself from that self-isolation is by getting a negative test. And the other difficulty that it obviously causes is that the contact tracing that we've talked about is a really important part of the control for COVID. And that only happens when somebody is COVID positive. So I'm not going to try and underplay the significance of the fact that we have got a very, very substandard national testing program at the moment. But I think what we are all committed to is making the best of what we have, and also ensuring that representation of the impact of it is made very clearly and very loudly to the Department of Health, as well as Public Health England, NHS Test and Trace, and the Secretary of State for Health.
Thank you. Thank you very much. Are there other questions, please?
Can I make a comment, Malcolm?
Sorry, yes.
It's just while we're on the topic of testing and so on, I'm sure it'll be covered later, but flu vaccinations and that being a really proactive thing that we can all do as community members is seek out our flu vaccination where eligible. The data is showing the morbidity of COVID and flu together is startling. So I think that would be an important conclusion to some of the discussion we've had this afternoon.
Yeah, I mean, I believe the target now in the NHS is 100% for flu vaccination, is it not? I mean, you know, what's been quite worrying in the past is that when I looked at, for example, paramedics, that only about 60% of paramedics in previous years were getting flu vaccinations. So clearly, we've got to do more to make sure that, for example, all hospital staff are vaccinated. And now in the new categories, it'll be from 50 plus, I believe, is the program for the future. So yeah, a lot more needs to be done. Could I then ask another question, which is, in relation to people who are going into hospital for operations, I believe the rules now state that the person needs to have a test 3 days in advance of their operation and to self-isolate for those 3 days. And I know it's a discussion that we've had before, but how in the circumstances where people are living in very crowded households, how do we ensure that people can self-isolate so they can have the surgery that they may urgently need? Anybody like to respond to that? No? No response?
I'm not sure what, I mean, it's very difficult, isn't it? Short of bring people temporary accommodation in some way or other, that, you know, for 3 days so they can be on their own. That would be a massive undertaking. Yeah.
Okay.
I think it's just, it is very difficult. At least it's only 3 days now. Before it was, you know, considerably longer, 2 weeks. So
it was 14 before and after before. Okay, I don't have any more questions.
Can I just say something more about the flu, Malcolm? Just in terms of really encouraging people to come forward who have been contacted now, that the practices and certainly pharmacists are getting their supplies. Not everyone's got their supplies yet. They're coming through, different practices have received it. So it's been the last week or so, it's really got going. And some people are reporting more people coming forward, and some people are reporting fewer people coming forward. And I think the 50 to 65 cohort, who, if you're not in one of the cohorts of that age group because you've got a chronic condition, you're fit and healthy, but just happen to be between 50 and 65, you won't be getting your vaccines until at least November, because the supplies and government policy is quite clear that it should be targeted at the most vulnerable first. So the people who have got chronic illnesses, or the people who are over 65. So they're the ones who are being contacted by practices. There is communications going on in all manner of ways from practices across local systems across North East London. And I think it's just, we really do worry what potential impact could be on people's health of having COVID at the same time as having flu. We don't know yet, because that hasn't existed, but there's reason to believe it will be very detrimental to people's health. So we're really keen for people to come forward and get those vaccinations now as soon as possible, and they'll be getting texts from their practices, and please come. I know there's a great deal of misinformation about the flu vaccine, and I would just encourage people to have the jab, because it could be hugely significant in terms of protecting your health, and of course the health of others. We want flu to be circulating as little as possible this season, and actually, of course, it's another reason to maintain those social distancing measures, etc., because obviously that will help reduce transmission of COVID virus. It'll also help reduce the transmission of flu. So it's, you know, there are many reasons for continuing, you know, redoubled efforts in terms of all the infection prevention measures.
Could I just comment on that as well?
Please have your flu jab.
Can I just comment on that, Malcolm, as well? Yeah. I think the flu campaign is extremely important. I am concerned, though, that it's taken a long time. It's taken a long time to go. There's no national messages on it as well. I mean, I'm pleased locally messages are being produced at the moment, but it feels like it's being a bit late. And certainly from what our survey, NHS Community Voice surveys told us, is that a lot of people distrust information now from central and local government. So there's a real big issue there. And the East London Health and Care Partnership has just issued their citizens panel findings on local residents have told us about the flu. And that's indicated some really kind of worrying numbers. Around 37% aren't going to take the vaccine because they're concerned about the side effects. 9% don't think they need it. 8% don't believe in it. And 5% don't like needles. I think there's a big issue around kind of really pushing this, and I think there's going to be a lot of work with the community to make sure people do get vaccinated, because I am really kind of quite nervous that this is going to be a campaign like last year that fell flat on its face. We can't have it falling flat on its face this time. It has to be a big push.
Laura Sharp from the GP Confederation says, sorry,
Malcolm.
1 second, Laura Sharp from the GP Confederation says that a big campaign is about to start. So we look forward to that.
Malcolm,
so was somebody trying to speak?
Yes, I'm trying to let you know that I submitted questions through the office, and if you don't have any further questions, there's something very remiss.
Is that Susan Wengrow?
Yeah. Yes.
Okay, I can't see any questions from you. Do you have a question you want to submit now?
Well, I've been extremely unwell, and I can't remember how I worded the questions I gave to your colleagues.
If they're written down, we listen, Susan. If they're written down, I can promise you that we'll get answers to your questions. So don't worry about it. Even though we kind of do it this minute, we will make sure that you get answers in the very near future.
Thank you very much.
Okay. Now, if there are no more questions, then I'm going to ask Antonia to come back. Are you there, Antonia? Antonia? Oh, what a wonderful system. Right. I can't contact Antonia. John, you got any ideas?
I'll give her a ring. Let me just step out and I'll give her a ring.
Antonia, if you're speaking, you're on mute, so we won't be able to hear you.
Sorry about this, everybody.
Shall I just pick up?
Yeah.
There was a question I can see in the Q&A that's around mask wearing for carers going into people's homes.
Really?
Mal's put
Maybe
it
that's a new one.
on behalf.
Okay, it wasn't one that I'd seen, so maybe some new ones have come on very recently. So there's one from Jamal Wallace, Shirley Watkins, from Shirley Watkins. It says, COVID-19 has begun to spike again. My mother is vulnerable, housebound, and has carers 4 times a day. They are wearing only 1 face mask per day. I contacted the care agency who told me that it is the guidelines that they have been given. They go to different houses, on buses, etc. This is a public health concern. How is this allowed to happen?
So shall I try and answer that one?
Yes, please.
So there was a significant shortage of PPE a few months ago, of which face masks were part of that shortage. There was guidance that was issued that did say that people could use face masks to provide care in a number of different settings. So if you were going from one house to another, it may not be necessary to change the face mask between those houses, but only on the basis that that face mask was put on appropriately. People were using good universal precautions to do that. And if the face mask became soiled or became damp, it did need to be changed. So if somebody's wearing a face mask for the whole day, that is definitely outside of the guidelines. Now, I am aware of, but I haven't read the guidelines, that they actually then, because there is no longer a shortage of PPE, that they did actually change the guidelines and then brought it back so that PPE should be wear for each individual patient episode of care. So I would need to just go and check, and I can probably do that in the next couple of minutes, and then post the guidelines. But certainly what's been described would not be in keeping with the best practice, because if someone was wearing it for a whole day of activities, that face mask would almost certainly get soiled. It would get damp from just normal sweat and perspiration. So it would be of a concern, but I will find the guidance and I will post it into the chat.
Okay.
I should say that, can I just add to that, Malcolm, because it's the same policy as in other healthcare settings as well. The mask mustn't become moist and wet, but if it hasn't become moist and wet, then it's fine to continue to use. The key thing is you don't touch your mouth, your nose, and your eyes, because that's one of the key ways of transmitting the virus into yourself. You don't touch your mask either. If you take it off, you take it off behind the ears very carefully, and during a clinical session, we just keep it on. So it's not, it's the how long you've kept it on for, but the fact you might keep it on for a period of time is actually part of the guidelines. I know Chris will check on it, but it shouldn't become moist and wet. That's the thing.
No. And I wonder whether some proactive work can go on with the local care agencies just to make sure that they're aware of the rules. It might the guidance. It might be advisable to reinforce the guidance with the local agencies providing care. We got another question here. It says bus drivers in Hackney are allowing people to get on without masks. What is the council doing to protect passengers and the Hackney community? Anybody like to take this question about buses? Buses. No takers?
I mean, I'm presuming Chris might be able to mention something about the environmental health officers and their efforts to support TfL and others.
I mean, it's certainly becoming in many ways easier. I think it's from Monday, because the COVID secure guidelines are being written into law with penalties attached. And so there will be more enforcement activity. I think it does have to be a partnership between, the local Metropolitan Police and also environmental health and others. But there is certainly going to be, I think, more clarity about when people should be wearing masks, and then the fines and the penalty notices, and also for some of the businesses they will be inspected. I did answer one of the questions. They can be inspected by environmental health. There are certainly visits that I'm aware of that are planned because members of the public have highlighted where a business is not complying with COVID secure guidance. But I think one of the really welcome changes that did happen is that clarity. What was guidance will now become law, and then there will be fixed penalty notices. So that, I think that will help compliance. Will make it easier for all the enforcement agencies to help ensure face mask wearing, as well as all of the other social distancing guidance, which actually are really important as well.
Yeah. I mean, there's a question here, bearing in mind, basically what the question is saying is bearing in mind that there's a higher rate of COVID-19 in Stamford Hill. The person is suggesting that more action should be taken to persuade people in that area to use masks.
So
I don't know.
Mark, I can very briefly talk about it. So we have been working. So we have an outbreak, an incident management team, and basically looking at how we help respond to that outbreak. There has been a week of action. We did have the Cabinet Office visit, and we showed them what was being done by both the council, the NHS, and as well as the police. The handing out of masks. There's been some dot matrix signs that explain to people. Really good engagement with members of the different faith communities, as well as with GPs in that area, to make sure people really do understand the guidelines at the moment and social distancing. I mean, I really do want to commend the engagement that we have had with some of the religious leaders in order to ensure that the messaging around, particularly key religious festivals where people would normally want to come together and meet and socialise has been really, really carefully and well communicated. So I am really grateful for that support we have had from members of the community and members of the religious community as well.
Good, thank you very much. I think that's all now. I think that's the end of the questions. I don't know whether Antonia has returned, but I can't see her. So I think, in that case, I think we need to close the meeting. Antonia, you've come back. Antonia, would you like to present your items?
Yes, please. Can we have the slide, please?
That'll be the finance slide. Do you have that?
Yes, just bear with me.
Thank you.
The meeting will close at 6:30.
Okay. Good evening, everyone.
We've been hunting for you.
Yeah, I was here. Then I went to quickly get a drink.
All right.
Slide, yeah. Are you okay, or do you?
Come in, here's our finances.
Yes.
You see how little money we've got.
Good evening, everyone. My name is Antonio Nigbode. I'm the treasurer for Healthwatch, and I welcome you all tonight. Basically, in front of you, you can see the slide that shows our accounts, our income and expenditure for 2019 to 2020, meaning up to 31st of March 2020. You can see that our total income in 2019-2020 is £389,878, and it gives you a breakdown of where those funding originates from. 150K is from London Borough of Hackney, 8,677 is from City of London Corporation because we were finishing the task of work for them. 224K, £136, it's from NHS clinical commissioning in order to do various, to carry out various projects, and 7,000 is from other income. So our total income in the year was £389,878. And our expenditure is also detailed below. Operational costs, which include project direct cost, is 73,281. Staff cost, £282,669. Premises cost is 17,367. Healthwatch City of London, 11,660. Our total expenditure in the year was £384,977, and we made a small profit of £4,901, and that profit is not genuine profit because it's profit that is carried over into this current financial year to be able to deliver some of our projects. And that's our finance for 2019-2020. If you have any question, please do ask.
Well, thank you very much. Any questions, please? Any questions? No? Going, gone. Okay. And did you have another report as well, Antonia?
I think you kindly mentioned the report, but I can go through them again. It's just to thank all our new directors and also to thank all the directors that left, that served during the year 2019, 2020, and also to appreciate our chair, Rupert, for a fantastic work he did over the year, and we wish him the best of luck for the future. So you've already introduced the new director, so there's no point in mentioning their names again. Apart from that, okay. Healthwatch is a community interest company, and we make sure we tend to focus on the community, and that's what we've been discussing in the last hour. And so for that, I've basically reported my secretarial duties. Thank you.
Okay, thank you so much, Antonia. And so can I thank Philip, Mark, David, John and Chris for being part of the panel. And we're very grateful to you for your contribution. And we're very grateful to you for the collaboration we have with you on so many issues. So, and thank you for everybody who's attended today and our board members for all the work they put in, and our fantastic staff. So now the meeting will, I'm afraid, be closing. But thank you so much, everybody. Bye-bye.
Bye. Thanks, Malcolm. Well done, colleagues.
Thank you.
Thank you. Cheerio.
Bye.